And so it keeps them really cold. The cells are basically in a suspended animation, can be there for years and years.
The cells of Parkinson's patients ready to return to the patient and erase the ravages of the disease.
We're taking the latest technology where we can take skin cells from our patients and we can make them into stem cells. And then we use that as a tool to make the neurons that are lost in Parkinson's disease.
Dr. Andres Bratliel with Scripps Research Institute is the lead scientist for Summit for Stem Cell, the fundraising arm for this one-of-a-kind research.
When you're using a single embryonic stem cell line, you can just make a lot of cells and treat everybody. So what we're having to do is really focus on making really good, high-quality cells from each one of our patients.
This lab is the only group in the world using a patient's own skin cells to treat them.
That's what makes our project different, is that we're actually making neurons from the same patient and putting them back into their own brain.
The expected result? No rejection by the body.
If we have the really good quality cells, that we're going to give people a lot of relief from their symptoms, and that these neurons should survive and grow in their brain for 20 or 30 years.
Believed to bring complete relief from muscle weakness, stiffness, and shaking.
To actually change the world of Parkinson's disease, reverse the motor symptoms of Parkinson's disease by refilling the bucket, by actually giving people back the exact cell that is lost in the course of the disease.
Sherry Gold leads up fundraising for Summit for Stem Cell.
We've got millions of people around the United States who have Parkinson's disease, and that disease cannot be reversed until our stem cell therapy comes about.
Feeling this 24 hours a day, 7 days a week, not feeling normal, feeling tired, stiff. The possibility of treatment for that is overwhelming.
Chris Whitmer had tremors years before being diagnosed with Parkinson's at the age of 47.
Feeling this 24 hours a day, 7 days a week, not feeling normal, feeling tired, stiff. The possibility of treatment for that is overwhelming.
He will be one of the first patients when Summit for Stem Cell gets the $8 million needed to trigger the green light from the FDA.
You know, as my disease progresses and I'm worse and worse, I mean, every 6 months I'm worse, I feel it.
In the world of research, and you talk about drug development, $8 million is almost like a drop in the bucket.
Why aren't you afraid of it?
I am not afraid because I've gotten far enough along with Parkinson's to know what it feels like right now to have Parkinson's. And I know what my life's going to be like down the road with Parkinson's. And that makes me not afraid.
Eric Robertson is a respiratory therapist and an avid biker. He calls his Parkinson's diagnosis at the age of 48 a game changer.
Putting on a glove, using a keyboard is really tough. That's getting really tough to work in. I find myself getting slower, even my speech, just like right now.
Now he says it's tough walking without a left foot drag, difficult even tucking in his shirt.
I choose to stay out of the intensive care unit and out of the emergency room because I recognize that my thought processes are just slowing down. I'm just not as quick on my thinking. And I just want to do what's best for my patients.
He knows that all current drugs for Parkinson's only work so long.
Trying to hold off as long as I possibly can.
Conserving the drugs until his cell replacement therapy gets to trial.
I'm just ready to step through that door and I can't wait for it to happen.
Gold knows the clock is ticking.
We've got millions of people around the United States who have Parkinson's disease, and that disease cannot be reversed until our stem cell therapy comes about.
This science will help others too, suffering from Alzheimer's, Huntington's disease, ALS, and even heart disease.
To bring some relief to these people who have no future to look for other than more neurodegeneration and loss of the cells.
Relief, and most of all, hope.
I want to see my son excel in life and be there with him.
My hope and prayer that 5 years from now we're sitting together having a toast and everybody's smooth as we can be with no tremor whatsoever in any of us. And what a great day it'll be.
I want to walk my daughter down the aisle someday